Hey everybody, Dr. Trey here, the founder of The Trans Trainer, where I provide physical therapy, post-op programming, and fitness coaching to other queer and trans folks. I've been getting a lot of good follow-up questions based on my scar massage video yesterday. So I figured if some of y'all have these questions, I'm sure others do too. So I wanted to make a little follow-up video answering some of these. And as always, hit me up with other questions because I would love to help the community and be that educational resource. So I've been getting a lot of good questions about whether vitamin E lotion is better or worse than Mederma or Scar Away for your scars. Now, for me, those are two separate categories. And what I mean by that is I'm using the vitamin E lotion solely as an avenue to do a scar massage with. If we're just looking at slathering vitamin E on and Scar Away on, the research is definitely more with the Scar Away. It does show that the silicone in that compound does reduce especially hypertrophic and keloid scars or thickened scars, as well as decrease the redness of scars. But we can't just slather it on. Okay, we also need the scar massage to break up the scar tissue. So vitamin E or coconut oil or any other kind of plain lotion, that part doesn't matter as much, but you have to do the scar massage. And then yes, the Scar Away, Mederma or anything like that works great in addition to. Now, I personally found that the silicone strips did a lot better on my scars as opposed to the roll-on stick. I found the roll-on stick super expensive. It was so hard to get the stuff to come out of the bottle. But the silicone strips worked really, really well. For top surgery in particular, I liked the big long roll of it that looked more like a roll of KT tape that then I could cut in half the hot dog way to make it really skinny, and I could get one full piece to cover each scar. Now save the backing, save that plastic back that the stuff comes on, because then you can put it back on there when you're done using it and you can reuse that same piece, I would say about a week. What I personally did was I did the scar massage during the day and I put that regular old lotion on during the day. And then I went to work or went to school or whatever I was doing where I was getting sweaty and gross and whatever. And then at night I would shower, and right when I got out of the shower, I would put the silicone strips on and I would sleep with them all night. And I found that that was a better bang for my buck because they stayed on all night and I was able to reuse them a lot longer without sweating them off or putting them on over lotion. So that's personally what I found that worked really well. The caveat to that was for my RFF scar is I actually got a silicone sleeve that pulled on, and that's, surrounded the entire thing. And then once the arm was doing relatively better and I just had a couple spots here and there, then I switched back to the tape. So yes, Mederma Scar Away works great. However, it's in addition to, not instead of vitamin E. The other question I had was, well, shoot, I didn't know about this, Trey. I didn't do anything for my scars and now I'm a year out and they're really thick or they're too red. I don't like the way they look. Is it too late? No. Okay, it's not too late. I would say, first of all, if you do have areas that are still restricted, the scar massage will still help. But if your scars are just bigger than you would like or aesthetically just not what you're looking for, but they move, then the scar massage isn't gonna do as much. The silicone will still help. The difference is the longer out you've been from surgery, the longer you're gonna have to use the silicone consistently to see a change. So if you're pretty fresh out from surgery and you put those silicone strips on, again, this is when it's a scar, not an incision with the silicone strips too, okay? Is you're gonna start seeing changes within weeks to a few months. But if you're a year out, let's say, it might take you 3 to 6 months consistently of using the silicone to see a change. So it's not all is lost, but you gotta be a little bit more patient with it. It can even be on older scars, and this does not have to be strictly gender affirmation surgery scars. This could be an ankle reconstruction scar. It's all the same, okay? The other thing I wanted to touch on that I didn't yesterday is you would not take a newborn baby out in the sunshine without either covering it or wearing a ton of sunscreen. So we need to treat our scars the same way. These are fresh skin, okay? So for that first year, I either want them covered, whether that be with silicone strips, KT tape, wearing a shirt, right? Or like literally baby sunscreen. And that's every time you go out. Like I'm a big runner, I take my shirt off when I run, and I don't normally put sunscreen on when I'm just going for a run. I usually use sunscreen more for like the beach, which I know is not the right answer. I need to do better. But I started putting it on every single time I would go outside without my shirt on, to the point where like I had white strips here and the rest was tan. But after a year, it can all start to heal back up, then it's no problem to get it exposed to sun and just put sunscreen on as you normally would. But for the first year, the less sun exposure, the less red it's going to be. I found a little of exception to that is my RFF arm scar. To this day, especially on the incision line, still gets burnt a lot faster than the rest of my body. So I still have to put, like, I might not put sunscreen anywhere else, but I'll put it on my forearm, or I'll reapply the forearm more. So yes, every scar is a little bit different, but for sure that first year. So as always, if you have any other questions or concerns, please shoot me a message. I'd love to help be that educational resource. And if you want some more one-on-one help, whether that be from preparing for or recovering from a gender affirmation surgery, or really any other surgery, or any kind of past injury, or you just want to get stronger in your body and feel more confident in your body, I would love to help you out. Go into my website, thetranstrainer.com, and book yourself a free consult so we can talk more. All right, thank you.